Hello, my beautiful ladies and mommies. You're welcome back to the channel today. So today I'm going to be sharing some tips that will really help you to have a smooth pregnancy. So if you're already pregnant, I think this video is exactly what you need. Or if you're trying to get pregnant, you also need it because it's going to really help you to get yourself prepared so that as soon as the pregnancy comes, you know exactly what to do and what to avoid. So I'm giving out this information because I know that as a mom, it is something that has really helped me personally, and I think it will help you too. If you don't know already, I have an 8-month-old child, and I believe that the things I learned as a midwife and as a nurse, and also the things I researched personally and the information I got from friends and advice from other mommies like me, it has really helped me, and I think it's going to help you as well. So let's get into it. So I'm sorry it might be a bit noisy because I'm out here. We came out on a walk and I just decided to make this video. But I'll try my best to make sure I'm loud enough so that the noise doesn't overshadow my voice. So the first thing you really need to do is to book a prenatal appointment. Yes, you need to book an appointment with your GP or your midwife. So depending on where you are and what is the appropriate thing to do, currently in the UK, if you're pregnant, the first point of call is your midwife. In fact, in most pregnancies, you will only see a midwife until you give birth. In fact, when you give birth, it is also the midwife that will be there to take care of you and everything. So booking a prenatal appointment is very important. It's the first thing you need to do ASAP. You need to book this appointment before you are 10 weeks pregnant. So for this appointment is really important because there the midwife or your GP will help you to get all the information and support you need to have a healthy pregnancy and delivery. Yeah, you will also be expected to, do some investigations like some screening for some diseases like syphilis, HIV, or some blood disorders like sickle cell, thalassemia, and the rest of them. You will also be expected to check for some kind of birth defects like Down syndrome or other kinds of birth defects. So these are the things that are really important to be done once you book your appointment. Also, regarding your appointments, you might see just a midwife or a combination of seeing a midwife and a doctor. So it depends on your specific situation. So that's what is going to determine who you will be seeing for your appointments. So the second thing you need to do is to take your prenatal vitamins. In fact, taking your prenatal vitamins cannot be overemphasized. If you're a woman who is trying to conceive, you're not yet pregnant, in fact, this is the best time for you to start taking your prenatal vitamins. When we talk about taking prenatal vitamins, the most important of it is taking vitamins that contain folic acid because you need it very well to ensure that you have a baby that is free of neural tube defect. So it's a kind of birth defect that can happen if a woman doesn't have enough of folic acid. You're not taking your folic acid maybe before conception or even after you got pregnant. So the best thing is take your prenatal vitamins before you get pregnant. But if you're not taking it, take it as soon as you find out you are pregnant. Then the next point is get moderate exercise. Getting exercise is something that is really important for you because it doesn't just help you to feel stronger, it even helps you in your delivery when you're gonna give birth. There are different forms of exercise, but in general, exercise helps you to keep fit. It helps in blood circulation. It just helps you to feel better. It's helps you in your emotional well-being. So we have different kinds of exercises you can do, but make sure it's something that is mild, something that you can be able to tolerate. We have yoga, dancing. If you're able to swim, that's the best time to do it. We also have pelvic floor exercises. You can discuss this with your midwife. They will help you and teach you how you can do this so that it's going to help to strengthen the muscles of the pelvic wall. So doing these pelvic floor exercises will really help you when you will be giving birth, especially if you expect to give birth through a vaginal delivery. Next thing to do is to eat a balanced diet. So this is the third point. Eating a balanced diet cannot be overemphasized. In fact, whether you're pregnant or not, it is important to eat a balanced diet, especially when you are pregnant. Although some people have this I would say it's a myth. Some people say when you're pregnant you have to eat for two, but I don't really think that is the case. In fact, medically speaking, it is not the case. You just have to eat an extra 300 to about 400 calories a day, an extra 300 to 400 calories a day as a pregnant woman. So that is just a little addition to the normal thing you have to eat. But in all, the advice is eat small frequent meals. You don't have to eat so much. No, you just have to eat what you can tolerate. You don't need to overeat, because that's definitely not going to help you. But when we talk about eating healthy diet, just eat food that contain whole grains, protein, and lots of fruits and vegetables, because they will give you the vitamins that you really need to stay healthy and also help in the proper development of your fetus. So the next point is staying hydrated. And staying hydrated not just helps with the constipation, it also helps you to tolerate the blood loss you will experience during delivery. So the importance of taking enough fluids cannot be overemphasized in pregnancy. My fifth point is have the ability to communicate openly. Now, when we talk about communication, it's something that everybody needs, but more especially for pregnant women. This is because when we talk about communication, you find out that pregnant women usually experience emotional problems. Sometimes you just see yourself crying for no reason. Nobody has hurt you, nobody has done anything to you. You're not sick, you're not hungry, nothing, but you just see yourself crying. I mean, all of these could be due to the, hormonal problems, the feelings that come up at times. So having an open communication with someone you trust and someone that loves you and someone you love can really, really be helpful at this time. So, have that good communication with your husband, your partner, your friends, your family. Tell them how you feel, because, when you pour out your emotions, it really goes a long way in helping you feel better, especially during this time. So, that is one thing that helps me personally in my own time, and I think it's also going to help you. So, the seventh point is getting enough rest and sleep. So naturally, as a pregnant woman, you find out that you tend to sleep a lot more, you feel more tired. That is normal, that is expected for a pregnant woman. So that alone tells you that you need more rest and sleep. But know that getting enough sleep and rest will really help in the proper development of your baby's brain. So if you don't just want to do it for the sake of your baby, because at the end of the day, you find out that you feel healthier and your baby will also develop better. So the next point is informing yourself about pregnancy. That means getting yourself well educated about pregnancy. It doesn't mean you have to be a midwife or a doctor, but you should be able to have a reasonable amount of information, to help you get well prepared for what is to come. So, as a woman who is pregnant, it is important that you know the different kinds of or different modes of delivery, be it C-section, vaginal delivery. Even when you're having a vaginal delivery, you should also know that there is a probability that you may be given a cut, that is an episiotomy. You could also be given the option of having a forceps delivery. So these are things that you should know about to get yourself prepared for what is to come. Then, when we also talk about pain medications, there are different kinds of pain relief that could be offered. Do you want to have an epidural whereby you go through the whole labor without feeling any pain? So many women opt for that in this time and age. And some women say, oh, I do not want it. So this is a discussion you should have with your midwife or your GP before that day of delivery comes, because on that day is not really the best time to have that discussion, because at that moment you won't really be thinking right, and I mean you can't really make the best decision at that time. So this is the time to get the information, make your decisions, and get ready for that day so that everything goes smoothly and easily. Also, when it comes to informing yourself about delivery or pregnancy, there are things like postpartum blues, due to the so many hormonal changes that take part or that occur, you might see yourself having postpartum blues. These are things that are normal unless it gets to a certain degree. So there are things that are really, worth knowing about. And I encourage us all who are pregnant or who are trying to get pregnant to really educate ourselves when it comes to pregnancy. If you have any further questions about this, please drop them in the comment section and I'll try my very best to give you my answers. So let's get to the next point. The ninth point is staying positive. Yes, when it comes to pregnancy, it's normal for you to have fears because although I'm a midwife, I'm a nurse, I also had a lot of fears when I was pregnant. Sometimes I felt like, what if this happens? What if something goes wrong? Yes, it's normal for you. So it's really important that you stay positive, read things that will uplift your spirits. If you like to listen to music, that is the best time to listen to music. If you like to play, if you like to dance, these are things that will really help to keep you motivated. Some people also enjoy having good time with friends. So whatever it is that really helps you to stay motivated and happy, it's really going to help you in this journey of pregnancy, because naturally, due to the hormonal changes, many women tend to get irritated. So many people get into depression and other things that could happen. So at this point, it's really good that you make a good, connection with your friends, people who love you and want the best for you. And doing all of this can really help you to stay positive and motivated. And it's also going to help to improve your chances of having a good outcome in your delivery. And finally, in the do's, it's good that you practice good hygiene. The importance of practicing good hygiene cannot be overemphasized because as a pregnant woman, naturally your immunity goes lower. So you have a lower immunity compared to your counterpart who is not pregnant. So that is the reason you must make sure that you maintain good hygiene, proper hand washing at all times, making sure your clothing, your food, is prepared in hygienic environment. If you can, always try to prepare your food yourself instead of buying food that is prepared by someone else. It's not like you cannot eat outside, but if it is possible for you, make your own meals because you are more likely to prepare it in a more hygienic way than someone else doing it for you. So the importance of staying or living in a clean environment or maintaining good hygiene is something that you don't need to joke about. I understand this can be very difficult, especially when you start feeling that tiredness that comes with pregnancy. But at this point, it's important you also ask for help and also accept help from people who give you help. So that is my tip for you. And I hope when you practice all of this, you will have a happy and smooth pregnancy and delivery. So this is all I've got for you. And I can see it's already dark. Thank you so much for watching today's video. If you've got any questions for me, kindly drop them in the comment section. And I wish you the very best in your pregnancy. I wish you a safe delivery and I wish you have a healthy and happy baby. Thank you for watching and I'll see you in my next. Bye for now.